Okay, are you ready to go see Emily? Okay, so...
These are the days Laura Meffin says keep her going. The days she can see her daughter.
I'm so excited to see her.
Every visit starts off with so much happiness. But the end of it always trails behind like a shadow.
I think of the joy, the laughter, the fun we have. I always make the visits fun for her. And we just try not to think of the end. Mommy, hi. Oh, I love you, bunny. I love you so much. Oh, you're in the nice snuggly jacket, aren't you?
22-year-old Emily has limited verbal skills.
Are you excited?
But there's no mistaking how excited she is to see her family.
What game do you want to play?
Emily lives in a group home, and the pandemic has created a heartbreaking distance.
We went through a lot with COVID. It was traumatic. It really was. So I understand not being able to go in, but I need to be with my daughter. I need to make sure she's okay. I need to have her know that I'm there, that I haven't abandoned her. Yay, Bubby!
Emily has a neurodegenerative disease and has lived at Participation House in Markham for the last 2 years. When COVID hit, Emily got infected. So did Laura. Outdoor visits from a distance. It's the closest Laura and her son Tyler have been to Emily in months.
Are you happy Mommy's here?
Yeah.
Aw, I miss you, Bunny.
I miss you, Mommy.
I miss you too, honey. It's the hardest thing I've ever had to do, of not being there with her and being able to comfort her like a mother can just only comfort a daughter. It devastates me.
That desperate need to get closer to the ones they love. Ever since the lockdown, Marla Di Giacomo organized one protest after the other in front of her mother's long-term care home in Toronto. She was fighting for the right to see her. 2 months after the lockdown, she finally did.
When we first saw her, she was in such terrible condition. She had lost 30 pounds. She was unresponsive.
It was a window visit, and it reflected someone Marla didn't recognize. Her mom, Helen, had withered away, and she got COVID. Marla started lobbying the home to be allowed inside.
I approached them and said, look, my mother is lacking human contact. She needs affection, attention, touch. That's what she needed as much as food. She needed love and attention.
Marla finally got access in August, and since then, the Ontario government has issued a directive clarifying essential visitors include caregivers. But directives can change, and Marla's afraid of being shut out again.
What kind of toll do you think it's taken on your mental health?
It's taken a large toll. I've aged, and I'm scared.
What are you scared of?
I'm scared that she'll get it again. I'm scared of what will happen in there,
That agonizing fear. With COVID cases climbing, there's no end to it in sight.
Over my 10 years of studying caregiving, I've never seen anything like this kind of burden or trauma placed on caregivers. It's tantamount to a form of post-traumatic stress caused from forced helplessness.
Vivian Stamatopoulos is an associate teaching professor at Ontario Tech University. She specializes in family caregiving and is an outspoken critic of the gaps in long-term care, especially chronic staff shortages.
What is so essential about being a caregiver?
Feeding. We had deaths because of dehydration and improper nutrition that could have been entirely avoided if family were in there, which they usually come at meal times. That's one of the biggest things family do in these facilities. They come around meal times and they help to make sure their loved ones are being fed properly. That kind of trauma of knowing that you can help and you're available to help and you want to help, it's a very serious level of trauma.
The trauma is personal for Vivian too. Her grandmother died in a home just before COVID hit. She can't imagine not being able to help her. She's turned her grief into action, pressuring the Ontario government to pass legislation that would allow caregivers access at all times.
I imagine every resident as my grandmother and what I would do to help. Because a lot of these people don't think they have power to do anything, don't know that they can use their voice and that they can affect change.
That call for change has spread across the country, from British Columbia to Nova Scotia. People like Holly Crooks say the fight now is about not repeating the past.
I'm a reluctant activist. I am speaking up because I cannot tolerate the injustice I see of a government ignoring the basic human rights of people like my mom.
Holly's mother, Yvonne Schwartz, is a resident at Northwood. The Halifax home was in lockdown until June. Then weekly outdoor visits were finally allowed. Holly's mom, once active and mobile, had to be wheeled out.
When we finally got to see her for the first time, June the 20th, her 90th birthday, she had to be brought to us in a wheelchair because she can no longer walk any distance. And that acquired frailty is a direct result of enforced inactivity for months on end. And at age 90, that acquired frailty is not something that she's likely to recover from.
Does it make you feel lonely or sad? Yeah, it's really hard to be separated from you this amount.
It's taken all summer and hundreds of emails to government officials to finally get what she was fighting for, essential caregiver status. That means she can now visit her mother in her room every day, at least for now.
This is the last period of her life. We want to be there for her as a family and make that as enriched as she deserves. I am angry I had to fight this hard, but I would do it again, considering what was at stake.
Is that a bit better? Is that warmer?
Time is slipping away. There's a chill in the air. Winter is around the corner. Laura doesn't know what will happen when it's too cold to visit outside.
Your hand is so cold.
Emily's home hasn't guaranteed indoor visits. Without a law in place, there's just more uncertainty.
Let's pack up. She kind of knows when the visit is nearing the end, and she starts getting quiet, and she won't talk to me.
It's okay. Mommy will be there, okay? I'll come back, okay? You know Mommy loves you.
And the hardest part is when she wants to know when. And I can't tell her. I don't know when I will be able to see her again. I don't know when I'm going to be able to give her a hug again and be in the same room with her and be able to take her home. It could be over a year that I won't be able to be with my daughter. And that is heartbreaking. It's heart-wrenching. Okay.
I miss you.
Oh, I miss you too, Emily.
Aww.
Soon. One day soon, okay?
For now, Laura's left looking in, and that makes the end of every visit that much harder.
It's okay, Bunny.
Joanna Rumiliotis, CBC News, Markham, Ontario.